to tonight's Community Forum. My name's Terry Welsh. I'm the Chief Executive Officer of Mildura-based Public Hospital, and I'm delighted to be your host this evening. We have a number of people watching on Zoom and also through Facebook streaming, and we expect well in excess of 1,000 people to connect to us tonight, and I thank you for joining us. We're in unique circumstances in the Mallee. We haven't faced this before, so we have a panel tonight to help us, to support us and to guide us as we move through this journey. First of all, can I welcome our Mayor, Jason Modica, who's going to complete the acknowledgement to country. Thank you.
Thank you very much, Terry. I appreciate that. I would like to acknowledge the traditional owners and custodians of the lands on which we are meeting this evening. I pay my respects to elders past and present, and celebrate and respect their continuing cultures and acknowledge the memories of their ancestors. Thanks very much, Terry. I'll hand it back to you.
Jason, thank you for that, and appreciate your support and the work of council. So tonight we're going to hear from a number of speakers, experts in their field. Obviously, we're very honoured to be joined by Jerome Weimer, who is the COVID commander, who we'll hear from shortly. He's going to have a critical message for us all. This forum, as I mentioned, is being streamed live and is being recorded. And if for any reason we lose the stream tonight on Facebook, please, we will make sure that the recording is made available after the event. Please be mindful, with over 1,000 people online, we are not going to be able to answer every question. We ask people to be very respectful. This is not a political forum, and we do ask, if possible, we will address themes through the meeting. There will be opportunities to ask questions at 6:30 and beyond once the speakers have finished speaking, and we will utilise the mechanisms of chat either in Zoom or comments on the Facebook page. You can also ask questions if you are on Zoom by putting your hand up, and we'll come to you when it comes to questions to be able to allow you to speak and ask your question. We ask questions to be short and enable as many as we can within that half an hour window. Please, once you're finished speaking, or if you're not speaking, please be on mute. Very common online manners today. It gives me great pleasure now to welcome one of the key panelists tonight, and someone who's doing a terrific job leading us through this event, and that is Dr. Bruce Boland. Bruce is the Director of the Loddon Mallee Public Health Unit, my apologies, and he will give us an update on our current situation. Thank you, Bruce.
Thank you, Terry, for that very kind introduction. I too would like to acknowledge the traditional lands of the owners on which we're meeting today, and I myself am on Dja land today in the Bendigo region, and acknowledge, of course, Aboriginal lands of the past, present and emerging. So I'm going to provide just a quick snapshot of the current situation in Mildura. So as of 1:30 this afternoon, there were a total of 95 confirmed active cases within the local government area. That is literally changing hour by hour. So don't be surprised if the numbers that you see reported in media tomorrow may be somewhat different to that. We have seen a very steep increase over the last 6 days. So it was on the 5th of October that we started seeing our first rise in this particular outbreak in Mildura. By the 8th of October, we were clocking well over 15, approaching 20 cases a day. Yesterday, we had a very high day with 36 cases, and today the numbers continue to rack up, sadly. If you draw that on a graph, what you will see is that there's a very steeply rising epidemic curve, which is, of course, of significant concern. Of course, we've been active and responding to every case as they've been coming through in as quick and responsive a manner as we possibly can. From the Public Health Unit, of course, working with everybody locally on the ground and our colleagues at the Department of Health, Department of Families, Fairness and Housing, and many others. So in terms of the breakdown of those cases, currently we have a profile of 53 females and 41 male cases. So approaching even in a relatively, at this point, it's still only, approximately 100 odd cases or so. So fairly small total number in relative terms. Of course, every one of those is incredibly important and is a life that we need to do a great deal to respond to. The one bit of good news here is that to date, we have only seen 3 cases amongst the over 60s. And I think this is really consoling to us because, of course, we know that hospitalisation and harm is vastly concentrated, including with the Delta variant, amongst the older age groups. And I think that's an excellent reflection of the really high level of vaccination that has been achieved to date across the local government area. To date, in Victoria, in Mildura, about 88%, just over 88% of all Mildura residents have received at least a first dose, and approaching 54% have achieved a second dose. So that's an excellent base on which to build. However, of course, where we are seeing this virus gain hold, the same in Mildura as everywhere else, is amongst those partially or unvaccinated in the vast main where these cases will occur. And that still is 12% of the population yet to receive their first dose. So I think there's a very important message there that I'm sure Jerome will be spelling out later on. And that is basically, yes, it's a real thing. It's happening. It's on our doorstep. And if you haven't had that vaccination yet, please approach our vaccination services. Get yourself booked in as quickly as possible. Those rates also, it has to be said, do compare relatively well across the state, but we do have a lot of higher rates across some of our more rural districts as well. So we know that we've known for a while that we need to accelerate our efforts in vaccination within Mildura, and of course we've been planning a lot of that in response, accelerating that progress in response to the latest outbreak. We know, of course, that many of the cases that we've seen to date have very sadly been in Aboriginal community members. That isn't necessarily reflected in our data. And the reason for that is that during case interviews, it's a very detailed process, but Aboriginal identity is not always recorded. And that is a challenge that we have in the process of both case interviews, but also more generally in health data. So what we've got in the confirmed statistics is only 4 Aboriginal or Torres Strait Islander cases, but we know in reality that is a significantly higher level. And certainly MDAS and many other community groups and health services are responding to those cases as we speak. Finally, in terms of testing data, in the last week, we've done approaching 9,000, in the last month, we've done approaching 9,000 tests. And over the last 7 days, of course, as we've become aware of this outbreak, that has accelerated very, very quickly. Everyone would be aware, of course, of both Barrett's and Smith's excellent work, very high standard work that's done through that brilliant pathology service, available through walk-up through the Pathology Correction Centre there at 8 till 4 each day. But we've obviously added to that with testing for drive-up available through the old Aerodrome Oval drive-through site on 11th Street from 8:30 till 5:30 every day. And through that, over the last 7 days, we've done approaching 4,500 tests, which of course is a great reflection of the community's understanding that if you do have symptoms, it is absolutely critical to test, particularly at this time when we know we have cases occurring in the community, and obviously helping us to stop the spread is our key watchword. And that is where I'll leave my presentation.
Bruce, thank you. And obviously you'll be on our panel shortly for questions, and it's, you know, a wealth of information and a lot for us to absorb. So I'm sure some questions will come your way. It now gives me great pleasure to welcome the CEO from MDAS, Jackie Turfrey, and MDAS have been doing a tremendous job in response. So Jackie, over to you. Thank you. Jackie, I can see you're online there. Jerome, I might throw to you if Jackie's got some technical issues. So I mentioned before, we've had a tremendous day today having our COVID commander of Victoria with us, Jerome Weimer. A wealth of knowledge has been in this, COVID game now for an extended period of time and has seen it all. So Jerome, I'm going to hand over to you for a few words while we try and sort Jackie's technical issues out. So please welcome Jerome Weimer. Thank you, Jerome.
Great. Thank you, Terry, so much. And can also just acknowledge the traditional owners of the lands on which we're gathering today and pay my respects to elders past, present and emerging. And look, a huge thank you for allowing me to a brief time on this agenda today. It's been a really full day for me here today, certainly meeting so many local partners and getting a real sense of what's happening on the ground. Can I really recognise the phenomenally important work of particularly Madras, Sunraysia Community Health, obviously the team at Mildura Base Hospital where I am at the moment, the public health team with Bruce at Loddon Mallee, and the team with Martin at the City of Mildura. I mean, this is where we make the difference in terms of how we respond to these local outbreaks, how we work together to really get to the bottom of them. And I think just some inspirational people working so hard on the ground to get to the bottom of these outbreaks. As we saw at the beginning of May in the previous outbreak, there is a heap of work that we can do as a community to really get on top of this quickly. I know I'm happy we'll probably deal with the lockdown issues on the questions, but the decision to go into lockdown late on Friday, and it was a tough and difficult call for the public health team and the chief health officer to make on Friday. But with the emerging information that was coming in during the day on Friday, I think the team rightly felt they had no choice but to go for a short, sharp lockdown in order to make sure we really supported the whole community to deal with this. It's a really significant risk and challenge to our community here. And I think if we look at the case numbers that Bruce has taken us through over the last few days, I think that was a wise and well advised decision from the local teams. What we're dealing with now really is probably a number of different challenges. One is the approach we're taking to this response is in many ways quite similar to what we did in early May. So we're encouraging people to come out and get tested in significant numbers, and we're clearly seeing that response on the ground. And it was good to see the team at the aerodrome being pretty busy again this morning. It's also about making sure that we support communities to really have confidence in the testing system and to come forward and get those tests done. And again, we're seeing multiple examples of that around Mildura and around the wider state. What is different this time around compared to May is that all of us now have access to vaccination in volumes. There is no shortage of vaccine now in the state, and it's really now down to getting really the last 15-20% of community members vaccinated through first dose and a few more through their second dose, and that becomes that also allows us to respond to this outbreak a little bit differently. So we are being far more forensic and targeted in our exposure sites. We're being far more forensic and targeted about looking at which particular bits of transmission we're concerned about, and really trying to ensure we support the people who are most at risk from this outbreak gathering further steam. Although at the moment, we're in not a bad position in Mildura as a whole with 88.1% first dose vaccination, just over half, 53.5% second dose vaccination. We know there are pockets across Mildura and the wider Sunraysia area where we're still seeing lower levels of vaccination. So we're really keen to use the next few days and the next few weeks to really encourage the uptake of vaccination for those who haven't been vaccinated yet. So we'll put extra energy behind the vaccination hubs we've currently got running across Mildura, but also to providing some in-reach vaccination support where that's helpful and beneficial. We're really keen to also make sure we encourage people to complete their second dose vaccination, because that becomes obviously the best protection against getting seriously ill and ending up under Terry's care at the hospital. So we're really keen to get that message through and to provide as many opportunities for people to get vaccinated over the days ahead. There is a strong team that's now been mobilised. Obviously, the local partners will be very much in the lead. We're seeing a lot of support coming in, particularly from from Loddon Mallee as public health team run by Bruce, but also from our additional resources across our local agencies in DFFH and the Department of Health. And we'll continue to be there not only for the next few days, but for the next few weeks to complete that vaccination process, but also to ensure we can support everybody to get tested and to ensure we support those who are living with COVID at this point in time, or those who have been exposed to COVID over the last few days. Terry, thanks again for the very warm welcome I've had here today, and looking forward to being part of the questions and discussion and answer in a moment. Thank you.
Thanks, Jerome, and I think the whole community would just thank you for being here, and your guidance to us has been invaluable. We've all had these technical challenges through COVID and online management, and Jack, we appreciate you logging out and logging back in. So I'm going to throw to Jackie Turfree again from Madras, who's their CEO, for an update from Madras. Thank you, Jackie.
Thank you very much, Terry. Thanks everybody for coming tonight. What I really want to point out, the issues for us are that as a population group, we actually have lower vaccination rates than the vaccination rates that Jeroen just pointed out to everybody. On the stats that are in front of me this evening, our first dose vaccination rates are still only showing as 60.2% for the Aboriginal population. This is right across the northwest region, so it's not just Mildura. And also then for second dose, we're still only around 33.26%. So we're lagging somewhat behind the rest of the population. What I will say is that Madas has been running a vaccination clinic 7 days a week. What we made the decision to do when we noticed that there was a reluctance to come forward and get vaccinations on the part of our community members, and I need to be honest about that. There's real hesitancy around getting the vaccines. There's real distrust of the system, or there has been. The best that we could do in that circumstance was do our best to vaccinate the rest of the community on the basis that the more people you have immunised, then you generally can protect more people. Unfortunately, at this end, it means that we need to be rethinking how we're approaching our vaccination and the style that we're doing that, and how we go about getting people to come out and get tested, because again, there's a fair bit of fear in my community about getting tested and getting vaccinated. So they're our greatest challenges. The other thing that we're really seeing a trend of in our space is essentially the reluctance of our mob to come through the mainstream service support systems. They've very much preferred to come through us as the Aboriginal service provider. So that's for food support and other essential support, medication support. So we're doing our best to cover our own cohort. And I must say, we haven't been doing that alone. In any of the space we've been working in, we're not doing it alone. All of our service providers, the whole industry in town, have pulled together really well. Everybody's assisting us in our space. We're assisting others to the extent that we can with what we're able to do. And the one thing I'll say about particularly Mildura and the service industry, or grouping up here, is that we do work really well together and we do support each other really well. And I couldn't have gotten this far with the work that we've been doing, which is critical work, without all of that support.
Jackie, thank you, and congratulations for the work you and your team have done. It's been tremendous to be able to work in such a partnership, and I thank you for that and being with us tonight. Look, we're on time already. In fact, we're in front of time, so this is fantastic, because the more questions we get to ask, the better. I can confirm there is 2,300 people on Facebook, plus many more on Zoom right now. Thus is the interest in this forum, which is a fantastic sign of the commitment of our community to move forward. Let's not miss this opportunity to ask any questions. I do repeat, this is not a political session, so there will be no grandstanding. We want to be able to talk about this event, our way forward, and what we should be doing, particularly with Jerome and Bruce with us. I welcome any questions from those on Zoom, either in the chat or please put up your hand and we'll take it from there.
Terry, Paul O'Neill here, Murray Valley Aboriginal Co-op. How are you?
Welcome, Paul. I just ask everyone to put their hand up, please, but thank you, Paul. Welcome.
First one to make a goose, mate. We're down in Robinville. Those who don't know me, I'm the CEO of Murray Valley Aboriginal Co-op. We've had some experience or some hesitancy in relation to mandating, and we need obviously continuity of service delivery. There is some talk around the region where, as of December 1, New South Wales, they're mandating for authorised workers is going to somehow disappear because the state of emergency is going to disappear. And therefore, if they hold out, the staff hold out long enough, then they'll be able to come back to work sometime in December. From the people that I've spoken to within the department, that's not true. And I had a fairly high-level meeting this afternoon. How are we able to negate that message, and how's the government, if possible, to assist us in instilling the fact that probably the mandating will not cease?
Jerome, I'm going to have to throw a few of these your way. This is a policy discussion, obviously. Can you cover that off for us, please?
Yeah, of course I can. Thanks, Paul. Look, I think I'll answer it in two parts. So, look, there is currently a requirement, a vaccination mandate that's been issued by the Chief Health Officer for any authorised worker. So, any of us who are working at the moment, going out and about doing our normal thing, whether we work in hospitals and health services or whether we're tradies working on construction sites, if we're an authorised worker, then we're required to get vaccinated, as Paul says. There is absolutely no intention to lift that requirement at any point, in the coming weeks or in the coming months. And as you say, Paul, obviously there's a long way to go with the current state of emergency, and legislation continues to be evolved over that period of time. And I don't think anyone's going to walk away from the mandated requirement, and happy to kind of continue that messaging. I think probably what I would say though is that although that, and let's maybe focus on the reasons why that's been felt to be necessary, which is that we know that, and what we've particularly seen in regional Victoria, is that it's been the transmission we've seen from clusters particularly in Melbourne into other parts of Victoria has by and large come about through authorised workers who are legally able and permitted to travel, but where they've not been vaccinated, they've been carrying. There have been many examples, numerous examples of them taking the infection unknowingly with them back into their homes and back into their communities. So that's why the vaccination mandate was introduced. We want essential workers to keep going, but we don't want them to unwittingly spread COVID around the wider state and particularly into regional communities. So that mandate will stay, but I would urge all of us to focus on, in the way that I think Jackie has, to focus on the positive messages around vaccination. This is how you now protect yourself. This is how you protect your household, your family, your mob, your community, because that's how that's the only tool we've really got to do that. Everything else we do involves lockdowns, involves taking things away from people. Vaccination allows us to give something back to people, which they can get on and live their lives. And we're getting pretty close to that.
Thank you for that. In the chat, there's two comments there from Hayley and Jenny. The second one about exposure sites, which we do need to touch on in 1 second, Jerome, please. The first one, Hayley, we are looking at in discussions today around the incident management team structure and some local connection, and keep building our local connections to smaller providers through council and other mechanisms. So take that comment on board, and rest assured it was actually discussed today. The second query is around exposure sites and the listing and non-listing and the timing. I'm going to throw it to you, Jerome, and then maybe Bruce wants to come in as well.
Yeah, great. Thanks, Terry. So look, so exposure sites, let me maybe stand back a bit from the exposure site question. So we list exposure sites when we think there is a significant risk of transmission to people who are at those exposure sites. Now, if we wind the clock back even 2 months, and certainly to the May outbreak we had here in Mildura, the view we took then is that exposure sites with very few cases in the community, with almost no COVID in the community, we were very keen to make sure that anybody who was any risk of exposure to COVID was locked down as quickly as possible. What we saw in the Shepparton outbreak back in August, early August, was that particularly in smaller regional communities, we ended up with about 120 positive cases in Shepparton. We ended up with around 50 to 20,000 people, about a third of the Shepparton community, in isolation because we'd listed all the exposure sites people had gone to. And the exposure sites that people that went to were supermarkets, because we all need to go and get food, and they've been to schools. And that locked up pretty much the entire workforce, not only in our health services, but in our police stations, in our ambulance stations, and everywhere else. It became a real significant issue about the viability of the town. Now that we've got higher rates of vaccination across the community, and more of us are protected and less likely to pick up COVID, we're now focusing on those exposure sites where we think there is a significant risk of transmission. So where people are not wearing masks, where people are in close proximity, where they are there for a significant period of time. So all the contact tracing that Bruce can take us through still goes on, but we're now far more focused on those significant risk events, as opposed to listing every single exposure and every single IGA and Coles and Woolies that people may have briefly been in. If people are wearing masks, if other people are wearing masks, if they're distancing, and all those measures that those big stores have in place, it's increasingly less likely that we'll list them as exposure sites. So across the state now, we don't really list tier 2 exposure sites at all anymore. There's a few legacy ones out there that will increasingly drop off. And it's also reflections as we start to step forward to those higher vaccination thresholds, as we start to ease off some of the restrictions in a few weeks' time, we'll continue to focus on exposure sites, but only those where we really think there's a strong likelihood of transmission having been present. I'll hand it back at that point, Terry.
Thanks, Duran. I appreciate that. There's a couple of questions in the chat if there's no hands up at this stage. Vaccination stats, I think we can push out after the forum if we can. Just take a note of that, please. In terms of management plans for smaller communities, Bruce, are you aware of the status of that? Or again, I might have to come to you, Jerome.
Yeah, absolutely. So obviously, a major concern in response to this latest outbreak is to do our darndest to get those people who haven't had the chance to get vaccinated yet vaccinated. And the big difference here is, for a long time, supply has been a real challenge. That issue of availability, fundamentally, while we've got availability locally, it's not been as accessible as it possibly could be for everybody within the community. So myself, the team, all of our partner agencies have been putting our heads together to really better understand how can we redouble our efforts? How can we put together mobile and pop-up testing and vaccination opportunities for people? Where should we be taking the vaccines to the people rather than asking people to always, in all instances, be coming in? And sometimes we refer to that as in-reach type of activities focused on a community or on a setting or a workplace. And how can we use this period particularly to be focusing on vaccination? Because obviously where we are seeing cases, and particularly where we see severe outcomes, where people are getting hospitalized, it's almost exclusively amongst those who are unvaccinated or only partly vaccinated. So that's the logic behind it. And there's been some fantastic thinking and work done by Jackie and the team at Madas, also by Simone Heel at Sunraysia District Health, and a whole host of other agencies coming together and starting to plan out how do we do this in a way which is really targeted towards those communities where vaccination just hasn't been accessible enough to date.
Thanks, Bruce. I appreciate that. Stay online there. A question from Philip Webster. Evening, Philip. Just about the current caseload and its demographic, if you like, in terms of penetration into the ATSI population. If you could cover that off, please, Bruce.
Sure. So as is, it takes time, of course, as everyone on the call would understand, to do contact tracing. And when we're having 30 and 40 cases a day come into our public health unit, it has been a real challenge to get through that caseload. And we've had some fantastic support from other public health units, from teams at the Department of Health, and also, it has to be said, from over the border in New South Wales, where, of course, they're also seeing some cases on the other side of the river, and they're super helpful in supporting us in our contact tracing efforts. What we're typically seeing to date is cases within households, obviously occurring. That's a significant concern. Where we see individual cases as well, that's a particular concern, because obviously we want to get there, understand where did those transmission events occur in order for us to step in and intervene at the source as rapidly as we can. With the number of cases going up as quickly as they are, it is quite complex, and it is rapidly evolving at the moment across Victoria. And the team of contact tracers and our epidemiologists, our disease detectives, are looking at that data literally hour by hour to see where the patterns emerging are. Sadly, there's certainly a story here around Aboriginal community here in Mildura, and that reflects, of course, Jackie's comments earlier on lower levels of vaccination for those communities and redoubling our efforts there. But also more broadly, I guess what you could say is the 10 to 20% of the community who are doing it the toughest. As an entire community here in Mildura, there's a higher level of social disadvantage than elsewhere across the state. But where we're seeing the cases is particularly pronounced amongst those most vulnerable and least rich parts of our community, which is, again, helping guide our thinking about where do we need to really drive our testing and vaccination efforts to make it as easy as possible, and create those incentives that make it easy, make it simple, answer the questions that people have got. And very happily, what we're finding is when we talk about vaccine hesitancy, that's exactly what it is. It's people asking, in the vast main, very reasonable questions that they want to have answered on their pathway to getting vaccinated. It certainly isn't a case of door slam in face, thou shalt never pass. Obviously, there are some people who have very strong opinions, and absolutely that's, of course, understandable. It's of their rights. But in the main, it's about bringing the vaccines to the people, making them as accessible as possible. That's certainly what we've been finding in the last few days in our drive into testing and vaccination in Mildura.
Thanks very much, Bruce, and we'll continue on with that vaccination journey. I'm aware some Facebook questions are coming my way, and I'll read them out in 1 second, so bear with us if they're on their way. The border, Jerome, we've been asked a number of times this today, including at your media conference this afternoon. Interested in your views about how we do manage the border with New South Wales opening up. Thank you.
Yeah, thanks, Terry. Look, it's an important question. Look, one of the many factors that I think the public health team looked at around the lockdown was, of course, the dynamics around the border. My short answer would be that all of us in Mildura, in the LGA of Mildura, not just the city of Mildura, but the LGA, we're all locked down. We've only got 5 reasons to leave our house, for essential work, for exercise or recreation, to get a vaccine, etc., to provide care. That applies and includes you can't leave your house to go over the border to go and go to a social gathering. You can't leave your house to go over the border to go to the pub. Those are annoying restrictions at this point in time. I completely appreciate that, but the reason we're all locked down in Mildura is that there is a real challenge for the whole community of Mildura that we have COVID cases, and we all need to understand how far those cases have gone, how far the virus has spread. So we really need to remind ourselves, like any other part of Victoria, if you're in lockdown, you need to lock down, as our colleagues in New South Wales have done over an equally long time over the last 3 months. Clearly, I think when we ease off the lockdown here in Mildura, and hopefully that'll be sooner rather than later, and we're all working very hard for that to be the case, then of course people have options to go back over the border under lower settings and to enjoy some of those greater freedoms. One of the reasons we put in place the border bubble community is to recognise that interchange of people living on both sides of the border, working both sides of the border, with friends and family and loved ones on both sides of the border. So that border bubble will continue. We're very committed to that. But whilst we're in lockdown and whilst we're dealing with this outbreak, please, primarily just stay home and let's get through the next few days and get to the bottom of these cases.
Thanks, Jerome, and I'll come back to you in a few seconds. But Micah's is feeding us our Facebook questions. So welcome, Micah. Thank you for the question.
Thanks, Terry. We have received quite a few comments and questions via Facebook, so we'll get through as many as we can. The first question is, if there were cases prior to the 5th of October and they escalated to more than 15 from that date, how come we were never informed of any exposure sites?
Look, I think we've done the exposure site commentary already, Micah, to some degree. I think it's been a changing methodology, as Jerome has already outlined. So I think that's just us adapting to that. We might move on from exposure sites to the next one, if you don't mind.
Absolutely. How do we protect vulnerable children under 12 who can't get vaccinated yet?
Terrific question, Bruce.
Yeah, absolutely. So obviously all of those core COVID safe behaviours really strongly apply, particularly for keeping kids safe. So what we know about social distancing, mask wearing, if it's feasible for kids, absolutely advisable. It helps stop the spread. Hand washing is absolutely key for kids and obviously has other benefits other than for transmission of other bugs as well, not just for COVID. So those kind of core protective behaviours are really important. You can be really confident that the plans for schools and for return of schools have been really well worked up right the way across the region and including in Mildura. Certainly in the local public health unit, we're well connected to our colleagues in the Department of Education and Training and our other public health colleagues across in the Department of Health in terms of monitoring and supporting schools in their COVID safe practices along with early childhood centres. Going to the earlier question around exposure sites as well, I think it's important to note as well that just because the sites aren't being published doesn't mean the teams aren't looking at them. We certainly are. In every single case we're doing a case interview, we're assessing what are those exposure sites and what might that mean for the general public. And believe you me, if there's stuff in there that we think should be communicated, we'll absolutely be linking with our Department of Health colleagues to make sure that it is appropriately communicated. So I think that's just a reassurance piece in there. But it is a concerning time, obviously, for anyone who's a parent or a young child And of course, it is something that is being looked at extensively internationally, particularly in relation to the safety of vaccines and the availability of vaccines. And that's obviously something that will be a national decision that Victoria will move on, I'm quite sure, as and when that evidence and the supply of vaccines is available and appropriate.
Bruce, just one query that I've had text through. So we're getting questions from everywhere, to be honest. QR codes, still worth the community doing QR codes?
Oh my word. Please, Lord, keep doing the QR codes. It's absolutely central. Cannot emphasize it enough. Literally, the first thing that the team do as soon as we identify a case and the exposure site is get a hold of that QR code data. And where there's gaps in it, it creates a real problem and a real risk of transmission. So particularly currently, it is absolutely critical that if you're going anywhere, do use the QR code, please.
Bruce, thank you. Michael, let's do one more question off Facebook. Then we'll come back to our Zoom queries. Thanks.
Thanks, Terry. You might be able to answer the next one. How many in hospital locally, and what is their vaccination status? Just bearing in mind these are the questions coming through from people on Facebook.
Understand. We have over 70 people in our hospital in the home program as we speak. We have rolling numbers of people through our hospital, so I'm not going to just give a number now because it will change within an hour. But we have been very busy with presentations and their vaccination rates are low. So that's been consistent with what's been seen across the state. Thank you for that question. Jerome, a question I have no doubt you're expecting, and it's an important one for this community in their planning. Will the 7-day lockdown continue after the 7 days?
Firstly, Terry, I hope so. And I think we're all working very hard to get to that place. If you look at our recent lockdown history and our recent experience, Shepparton went back after, was a 7-day lockdown, went back out. La Trobe, 7 days, was open back up again. Ballarat, 7 days, open back up again. Surf Coast, 7 days, went back up again. Mitchellshire is still in lockdown. We're reviewing that. That's been out for a few weeks now. And Moorabool, I think, was a week as well that it came out. So our recent form book is pretty good at 7-day lockdowns in regional settings, being only 7 days. The judgment call will be for the public health team over on Thursday and Friday of this week, at the end of this week, around are we still seeing, if we're still seeing cases that are not connected to each other, if we're seeing a large number of cases, if we're not confident that people are able to isolate effectively, they're all red flags. They're all things that would concern us. If we're seeing, however, really good testing numbers, which we are, if we're seeing community transmission that we understand the connections of, which we do at the moment, and if the number of cases coming through is starting to slow down and we're starting to see how those are shaping up, then I think that will give us much more confidence to ease off the lockdown. So no guarantees, but I think everybody here locally is doing absolutely everything they can. The community is doing everything they possibly can. We've got 3 or 4 really, really hard days ahead of us to do a lot of testing, to do a lot of vaccination, especially, and to work with people to understand what their concerns are and their barriers are, and to overcome those. So if we can do all that, then we'll be well set to get out.
Thank you. I know there's clearly 2,500 people very committed to the cause here. At what point would we know? I've had a question via text. When will either lockdown off, Jerome, or lockdown continuing? When would we know that, do you think?
So, well, we're due out on Friday midnight. So I would hope during the day on Friday. We'll obviously try and make a decision as early as we can. What we sometimes do is, as we did last Friday when we made a fairly late decision to instigate the lockdown, it does often depend on the information that comes in overnight. So we get a lot of case results coming in in the early hours of the morning. Our public health team, colleague Bruce and other colleagues, do need a bit of time to go through those and say, does that change our understanding of what's going on? So I appreciate it's hugely frustrating when we call it late. We'll do our best to call it on Friday morning, so give people as much notice as we can.
Yep, thank you. I've got a couple of queries here I think we can put together around pop-up centres in local areas, and I'm assuming that is for vaccination. And there's a question in the chat about a lot of people have had a 6 or 7 week wait for their Pfizer doses. Bruce, could you cover that off for us, please? Maybe pop-up centres and length for vaccination.
Yeah, absolutely. So I totally appreciate it can be really frustrating when you're trying to get those doses. Happily, we do have an increasing number of bookings available across Mildura. We're working very hard to increase that, and also Moderna coming online, and that's a really good, very, very safe vaccine, like all the vaccines. When we're in a rocky ship being hit by waves of Delta, any life jacket is a good life jacket, but obviously the new Moderna coming on live gives us another line of defense, and certainly that will be available locally. In terms of pop-up clinics, don't be surprised if you get a message in your Facebook feed, if you get a letter through your door, if you get even perhaps a tap on the door, to check out if you're living in one of those areas where vaccination rates are a bit lower. We are trialing and starting out doing some pop-up testing, and also trying to increase availability of vaccination in some of those local areas where we know vaccination rates and testing rates are a bit lower. So we are doing some more targeted, trying to reach the people who might have those questions that we can answer with a quick conversation. We can provide that reassurance that can make the difference between getting tested or vaccinated or not. So doing that real face-to-face community touch points and working with Midas and many others to make that as accessible and informative as possible locally.
Bruce, thank you. There's an excellent question here about planning or trends, I think, Jerome, for you around statistics, and what sort of peak number would you think we're trending towards?
It was a case numbers, Terry?
Yeah, I think it's about case numbers, yeah.
Okay, so well, that's a great question. So the highest number we've had, I think, on this outbreak, or the highest number of case numbers we've ever seen here in Victoria so far is just over 1,900, I think 1,950 or something. We got very close to the 2,000 mark a few days ago. Look, what the modelling tells us, and we use the Burnett Institute, highly skilled people who really look at the epidemiology, look at the dynamics, and then produce mathematical models about what it might look like going forward. What they've predicted is that we hit the peak of this wave in the next couple of weeks, so middle of October, so in the next week or 10 days, and then the case numbers should start to come down. And the reason where they think we hit the peak in the next 10 days is that's when the rate of vaccination starts to really slow down the level of community transmission. What we then see is in early November case number, so it goes down for a few weeks, and then in early November, when we open up, and when we're planning to open up with 80% of the adult population being double vaccinated, then case numbers increase again as people move around again, and as the virus essentially starts to go into the remainder of the community that hasn't been vaccinated. And that's a pattern we're seeing already, where the virus, the number of people who are catching COVID, over 2/3 of them are not vaccinated at all. So it is still far more likely that people who are not vaccinated are going to get the virus. And even when we open up, we'll still see case numbers becoming quite high, particularly if people haven't had their vaccination. So that is a risk. What vaccination will ensure is that although the case numbers will continue, we expect will rise a bit further in November and December. The number of people ending up in hospital should continue to be declined. So the proportion going to hospital should continue to go down. The proportion of people becoming seriously ill should be even lower. And of course, the people who don't make it should become even lower still. So that is why the vaccination program is so important. But the short answer, Terry, is, look, I think we're hopefully getting close to the peak of what we're going to see at the moment, and our numbers will start to trend down, or at least slow down over the next week or 10 days, and then start to drop off. But I would expect further down the road us to see, and we see this in Europe, higher case numbers. But if the vast majority of us are vaccinated, then that should not have a massive impact on our public health.
Understand. Thank you. Michael, we might now, I just want to let everyone understand we have over 500 comments on Facebook. So there is no possibility we can address. We're trying to theme things together. So please just appreciate that. Micah, some more themes or queries?
Thanks, Terry. A common question we've had is in regards to a testing site in Robinvale. Is one coming?
Okay, Bruce.
I was just discussing, in fact, this afternoon with CEOs from a number of agencies in Robinvale and local areas about the need for additional testing potentially. There has been a bit of concern, particularly for us, with some repeated wastewater, unexpected positive results, particularly in Swan Hill. So if we go kind of from Mildura, Robinvale, Swan Hill, clearly there's a significantly increased risk. And so we've been looking at that and starting to plan out what would enhanced testing and vaccination look like right the way across. Obviously, our effort is very heavily focused at Mildura at the moment, for very good reason, and we'll be looking as soon as we can to source the appropriate workforce to do those testing and vaccination clinics as rapidly as possible, including in Robin Vale and Swan Hill specifically.
Thank you, Bruce. Phyllis, in terms of the New South Wales Victorian border, obviously we've touched on that already. I'm just responding to a question. We're clearly asking people from New South Wales to do the right thing as well, but understand people are concerned, and we just have to continue to do the right thing on the Victorian side or on the New South Wales side. Obviously, we ask people to respect the lockdown, appreciating what that might mean. An interesting question here, probably for you, Jerome, in terms of, will the local lockdown have any impact on kids returning to school, my apologies, after the lockdown ends?
No, not after the lockdown ends. So when the lockdown ends, then of course the school arrangements will go back to what they would have been. We'll go back to what they are for regional Victoria. And I don't have the schedule in front of me, but we're seeing increasing groups of school kids coming back over the coming weeks, and I'm sure we're all hugely grateful for that. So while the lockdown is on, I appreciate the challenge of that. Schools of course are temporarily closed, with the exception, I believe, of the VCE years. I don't have that detail in front of me, but certainly when the lockdown is off again, then we'll be back on that school pathway along with the rest of regional Victoria.
Thank you. A question here about disability support services, and if someone does need to isolate, families expressing that it's very labour intensive and often difficult and need more support. Bruce or Jerome, could you answer, comment on that, please?
Sure, I can start. Maybe Jerome's got some other thoughts on this as well. Obviously, making sure that people are safe and cared for while they're isolating or in quarantine is really, really challenging for people. Obviously, the systems which are in place have been very heavily stretched by the current wave, and we've been working very hard through the incident management team to look at these issues of caring, relief and isolation and quarantine. I think there's been some accommodation, that is, and there's been some good step forwards on that. Obviously, local disability services already have got those plans and arrangements in place, and it is a very high priority, obviously, where people have got whatever needs they are, disabled, disability related, health related, and more broadly related to their personal needs. We look on that as far as possible. The only tempering thing I would say there is it is challenging for people. We can put in some supports. We can do as much as we possibly can to make that as easy a journey as possible. But quarantine and isolation is a challenge, and I think anybody who's been through that process here in Mildura or elsewhere in the state will reflect on the fact that it's a challenging period, and we kind of obviously that's one of the elements that we're trying to mitigate as a bigger impact than it possibly can have.
Thank you, Bruce, for that. There is a question in the chat on Zoom, which I will explain. It's around essential workers in vulnerable settings such as aged care. Can they attend if they live with a primary close contact of a positive COVID case? Jerome, can you cover off that just briefly if we can? I want to get through a few more.
No.
Correct.
Really clear. No. If you're a primary close contact, you should not be going out. Full stop.
Thank you. That is black and white, I would suggest. So thank you for that. Hi, Micah. We'll come back to you with a few more questions from Facebook or themes.
Thank you. The next question from Facebook we've got is there any plan to offer accommodation for people to isolate for those who can't quarantine in their home with family?
A lot of discussion about this one. Bruce, I'll come to you.
Sure. And to the previous question as well, if you're a primary close contact, super clear, don't go. If you're a secondary contact, that's a different set of situation. And particularly if people are double vaccinated, and of course, pretty much all of our aged and health workforce so far are double vaccinated. And if you're working in PPE, if you've been working in PPE and you personal protective equipment, that is masks and gloves and gowns and all the rest of it, obviously the risk of transmission is much, much lower. So it does need to be looked at on a case by case basis, recognizing absolutely if you're a primary close contact, no working, full stop, no leaving the home, please. In relation to, sorry, the specific question was on, I'm sorry, I've just diverted myself, Terry. What was the actual question as opposed to my rambling response?
The question was, is there any plan to offer accommodation for people to isolate?
Yeah, thank you. So in essence, limited supply is a real challenge. There's been some incredible work done over the last few days to bring on board some availability, particularly in the Mildura area, but it is not going to be enough. That means everybody who would like to access isolation or quarantine facilities will be able to. It is a limited supply, and we are looking at that on a case-by-case basis and very much focusing that towards the people who got absolutely critical needs. For example, they're a positive case and they live with someone who's immune compromised and who could have really severe outcomes. So we've made some great strides in getting local accommodation options, but it's certainly for the most needy, and that will be looked at by the public health unit, obviously working with colleagues who work in the various other services that would need to be put to wrap around those people on a case-by-case basis.
Thanks, Bruce. Michael, I'll come to you in 1 second. There's just a comment from Anita in the Zoom chat that we'll read out for the benefit of those on Facebook. So in relation to Robinvale, the health service is doing testing 7 days a week, working with Bendigo Health and RFDS to immunise people on both sides of the river. We've done 1,000 immunisations with a focus on non-Medicare holders, and there's other clinics, and MBAC is also immunising. So I just encourage the Robinvale community from that query before, just if in any doubt, contact the hospital, and sounds like they'll be able to guide you. Micah, I'll come back to you for another question off Facebook.
This one's, I think, I'm assuming specifically from a local business. The question is, if you are a tier 1 site and you are not listed as an exposure site for a week, do you still need to do a deep clean?
That's a great question. Jerome, I might come to you.
Yeah, it's pretty more for Bruce. I would always urge you to do a deep clean. I think I appreciate that the dates don't always line up, and let's maybe just explain briefly for everybody how the tier 1 sites work, and Bruce might want to come in on this. So we identify sites, exposure sites, based on the contact tracing interviews we do with positive cases. If a positive case tells us a week ago I was at this location and this is the movements I made, what we'll often do is then validate that with the if it's a shop, the owner of the shop, or we'll look for till receipts, or we'll look for QR code details, or if necessary CCTV, to get a sense of those movements and what that risk is. If we then determine that it's an exposure site, then it will go up. By that point, usually, but not always, usually the business will know about that. Sometimes we put exposure sites up before we've been able to get hold of the business. It kind of depends on the urgency behind each case. But it's quite common to list exposure sites a week or longer after exposure if we've only just identified the case and are just working with the case and they're describing the longer movements. A lot of it depends on when the positive case came forward for testing. So the longer they delay, the longer everything else gets delayed. But my recommendation would always be to a business owner, if no business wants to get caught up in a COVID exposure, and I recognise the disruption and distraction and the distress this causes for business owners, but I'd want to put a clean slate on it, do a deep clean, make sure your staff are okay, isolate as appropriate, and then reopen with confidence. Yeah,
I think that covers it off. Thanks, Jerome, for that. There's a question here in terms of workforce, and we all appreciate that workforce is, been through this on a long journey now. There's a question: are troops or the like coming to help us?
I can eventually. Look, I'd just say yes. The answer is yes. There's been certainly great engagement through Jerome, through many other colleagues in different departments, to both bring up staff, provide staff virtually. So much work is happening now online. We've been able to do all sorts of different contact tracing activities and other pieces by bringing people in online or physically up to the area. A lot of testing and vaccination staff are being brought up. Some community-specific staff, including for priority communities like Aboriginal communities, are also coming up to help with the effort up here. So absolutely, that's been great. And also getting help from north of the border in terms of both advice and also in terms of helping with the contact tracing has been really palpable. So we certainly have had a great surge of support from all of the agencies right the way across the state and indeed interstate.
Thank you. We're almost at our last question because we'll be wrapping up at 7 o'clock. Micah, anything else from Facebook that we need to cover off from a theme perspective?
Thanks, Terry. A few people have asked the question in regards to mystery cases in our region, how many mystery cases there are.
Bruce, would you be able to give us a comment on that, please?
Yeah, unfortunately, at this point, the number of cases that are working through at the minute makes that pretty much an impossible question to answer, unfortunately. We've had too many cases in the last 2 to 3 days to be able to identify solidly where we know there's certainly links between cases, where we think there's links between cases, and where there's real surety that this is a case which is outlying on its own, a genuine mystery case. So unfortunately, the numbers are a bit too high at the moment to be able to offer any sort of accuracy around that. Rest assured, that is absolutely one of the first and most important questions that our epidemiologists, our disease detectives are asking while we're looking at the data as it changes day by day.
Bruce, thank you. Thank you, Hayley. Hayley's just made a comment that aged care organisations are being invited to the incident management team meeting tomorrow, so we'll follow that through. Hayley, thank you for following that up so quickly. Sorry, I'm having to read this as we go. No, that's fine. Okay, so in terms of that, is there anything else, Michael? Any last question on Facebook, or Jerome? I'm going to let you have the final comment. So I'm not seeing a hand go up. Okay, Jerome, do you want to close for us? Maybe your thoughts in the next few days, and then we'll wrap up. Thanks very much.
Great, thank you, Terry. Look, I think first I wanted just to thank the 2,500 people who logged on tonight, and clearly some fantastic questions and a lively debate on Facebook, which is always good to see. So my thanks for everybody for tuning in and for turning out for this. This is a big moment for all of us to once again to wrap our arms around this, to support the people who are currently living with COVID in our community, to make sure they're getting the support and the care they need, and to encourage and support others to come forward to get tested and crucially to get vaccinated. So if there's one thing all of us take out of tonight, hopefully, is please, if you're vaccinated, that's great. Please look out for those people around you and encourage them to get vaccinated, because that's the only way we move beyond this pandemic. And secondly, just a huge thanks to the literally the hundreds of people working so hard across Sunraysia and Mildura to put this behind us. You know, the people in the healthcare system, the people in Madas, the teams of volunteers out there making all the differences. We're so grateful for everything that you do. Thank you, Terry.
Thank you. Can I thank the 2,500 people who have joined us tonight? In fact, it's more than that because we've got Zoom as well. We've had an enormous response on Facebook to questions, and we'll have to think about how we condense that information in some fashion. I'll come to you. I'm going to give Phyllis one real quick question here in a second. Phyllis, I'll go now. What is being done in terms of QR codes for farms and vineyards with the upcoming season? Jerome, can you cover that, or Bruce, quickly?
I'm sure answers I don't know in detail. Look, a farm is like any other kind of workplace. There's either, and the way this works for businesses is either the entire farm is essentially one great big QR code, one great big system business, and therefore they'll all get, if there's a positive case there, they'll all get caught up in it, or they'll work into subgroups, in which case QR codes of those subgroups become relevant. Okay,
Phyllis, that might be one that we take offline and follow up for you if it's not clear. Look, thank you for joining us. The intention is we'll pull together the themes, think about how we continue to push out that messaging through all the relevant comms. We're really interested to find out from some feedback if we should run another one later in the week, and we'll consider that in the coming days, and obviously as our caseload becomes clear. Can I thank the Department of Health for supporting us to pull this together? Can I thank key agencies, Sunraysia Community, the Rural Council, Mildura Council, Madas, obviously our health service here, and all partners for the work we're doing to try and work through this current event. I thank you all for being online. To those on Facebook, I hope it's streamed okay, and I wish you all the best. Keep safe, look after each other. Really important that we check in on each other just like we check in with QR codes at this time. I thank you, and I'll close the night. Thank you.